2310. Okay, so our first question is from Alex Winning from Reuters in Johannesburg. Alex says, is the Africa CDC and or the WHO Africa worried that countries like South Africa are sitting on large vaccine stocks, which either could expire or could be better used in other parts of the continent? And should there be more sharing of vaccine doses between African countries to address this challenge?
Of course, we are concerned with that. And we know that with respect to sharing, South Africa is probably one of the only African countries that has actively been involved in sharing vaccines. The problem is not because the government of South Africa doesn't want to vaccinate. The problem is the community uptake. And this is, again, an opportunity for me to appeal to the continent that unless and until we get out there and get vaccinated, we are not going to get rid of this terrible pandemic. So again, my direct appeal to the population in South Africa to get out and cooperate more with the government of South Africa and get their vaccines.
Okay, we have a question from the Portuguese news agency, Lusa. Maria says 14th February marks the second anniversary of the first case of the coronavirus infection in Africa. Could you please provide some comment on what went wrong and what went well in these past 2 years? And also a comment on how you see the situation evolving going forward.
So thank you. That is a very interesting question. You're right. The 14th of February will mark exactly 2 years since the continent started recognizing or identifying the COVID-19 cases. Let me start with the success stories. If you recall, on the 14th, when the news of that event, that is the first cases of COVID-19 occurred in Egypt. 1 week later, the leadership of the continent rallied around, and we had a summit of all ministers of health in Addis Ababa. It was the first time that in 1 week we could convene all ministers of health in Addis Ababa under the leadership of Chairperson Moussa Faki Mohamed to develop a joint continental strategy. So I think what worked so well for the continent was the ability to cooperate, to coordinate, to communicate, and to collaborate. I think it worked very, very effectively at the start, to the extent that when ministers left Addis Ababa and cases started occurring mostly around March, there was just clarity of action of what to do. And some countries actually took very drastic measures where with the occurrence of one case, they went into a state of emergency or lockdown. And it really helped blunt the spread of the virus. Second thing is the innovation that we learned that went well for the continent. We established, and I'll not name all of them, you know some of those, about 10 different initiatives as part of that joint continental strategy, including the platform to get commodities, what we call the African Medicine Supply Platform, then AVAD, the PAC initiative, which was designed to accelerate testing. So a lot of good things happened for the continent. What, of course, didn't go well was the overall collaboration within the international community to get access to diagnostics and access to vaccines and access to personal protective equipment. That was a challenge, a tremendous challenge at the start of that, to the extent that even when countries had money, in April and March of 2020, there was no way to go get diagnostics or PPE. So it was very challenging at that point. And to conclude, it also showed us that the continent was very, very ill-prepared. So we are very pleased that the political leadership, that the chairperson of the African Union Commission, Chairperson Moussa Faki, and our COVID champion, President Cyril Ramaphosa, exercised between 2020 and now has been remarkable. I mean, I call that effective hands-on leadership that has contributed significantly in fighting this pandemic. We hope and continue to be positive that that level of political leadership will continue.
Thank you very much. Before I give you the next question, let me just remind colleagues that they are quite free to come through live on this Zoom platform and also to continue sending their questions either through that WhatsApp number or through the question and answer section on this platform. Let's move over now to WhatsApp, and we have a question from Sarah Jerving, who is with DEVEX. Can you discuss more details on the path forward on the Africa CDC becoming a public health agency? And I think that's a follow-up to the developments at the summit that ended just a few days ago.
No, wonderful. I think that's a very good question, Sarah. We have now, as Africa CDC, submitted, as requested by the head of states, a roadmap for the operationalization of that decision, which includes providing a detailed structure to the subcommittee in the PRC. The PRC is the Permanent Representative Committee that will review that and approve it, and then it goes to the Specialized Technical Committee. And we have all of this must be done before June. Excuse me, before the mid-year summit in June. So those are the two critical elements. And in doing that, we also need to provide to that subcommittee, they call it the structure subcommittee, the financial implications of what the new Africa CDC status will bring to the overall financial burden of or financial implications of the commission. So those are the things that we need to do. And again, as I said, we didn't waste any time to rest. We have submitted that to the leadership of the commission. And in a matter of weeks or so, I'm sure that the deputy chairperson will be convening a task force again to start working on that immediately. Because June is not very far. We have to get ourselves ready. So the short and long of the answer is that by June of this year, we should be able to, if everything goes right, to be able to finalize that.
All right. Thank you, John. We have two questions from James Macharia Chege. And the first one is, you've mentioned that the BA2 Omicron variant is now dominant in South Africa. Preliminary data from Denmark and the UK suggests that the BA2 may have higher intrinsic transmissibility than Omicron. But scientists say that at present, the Omicron BA2 is not of great concern, neither is it a game changer. What is your view? Perhaps let's take that one and I'll come back with the second one later.
No, absolutely. I think looking at that, what the behavior of that lineage, I don't think we should panic because of that variant. Even if the transmissibility is higher than the parent Omicron, we don't see severity of disease, and we don't see any differences in vaccine response. So I will leave it at that. It may actually not be a game changer, and I'll use the word may very deliberately, but we'll see what happens. But again, absolutely no cause to panic if we do the right things. That is, we use the right mask with social distance as much as we can. I just explained to you that we did a COVID-free conference. I mean, there were more than 2,000 delegates that attended this the summit, and the data is what I shared with you. So I think we continue to now know how to manage, how to live with this variant. But I'm absolutely not worried about that variant. I can only be worried that if people behave differently, which is they don't respect social distancing, people don't wear masks. I think I was continue to use the opportunity of addressing this question to encourage our populations to go out there and get vaccinated. These vaccines work great. They are safe, they work great, including working against these Omicron variants and lineages.
Back over the COVID-19 pills. Are you
think Wayne is having problems communicating. We can't hear you, Wayne.
Repeat that question. Can you hear me now?
I can hear you now.
All right. The question from James Macharia Chege was on the talks with Pfizer and Merck, the COVID-19 pills. And he says, how far are you with that?
So let me just interpret what I heard. I mean, I don't think the line has improved significantly. We are still in discussions with both Pfizer and Merck. So there's no new development that I can share. These discussions take long. And I just ask that we should be patient, and we'll bring you any developments as they occur.
Okay, thank you very much. Alex Winning from Reuters has come back with another question, and she says, apart from South Africa's Aspen, do you know of any other African pharmaceutical companies that could make versions of the Merck pill that is under agreement and being negotiated by the UN-backed medicines patent pool?
No, I am not aware of any, but it doesn't mean it doesn't exist. It's just that my own limitation of the knowledge of where such a company may exist. And who knows, maybe in Egypt, Egypt is very advanced in manufacturing of drugs. They have demonstrated that with the hepatitis C drug, and Morocco can also perhaps have such, but I don't know. I mean, I've not seen any information that I can rely on to inform the question.
Okay, thank you. We have a question from Judith Akolo, who is with Kenya Broadcasting Corporation in Nairobi. She says, now that the Africa CDC is an autonomous entity, what does it mean, and how important was this move?
Very important, Judith. That means it gives the leadership of Africa CDC more flexibility to operate, and of course be accountable, which until now you have to, if say for example there was an outbreak of something in Kenya, the director cannot deploy people there immediately. You have to go through a whole series of approvals within the African Union Commission, but now you have that power to do that. Second is that the administrative support services we're never under the Africa CDC. We're relying on the commissions like the finance, the travel, the procurement, the budgets were all done outside of the Africa CDC. They would now be done inside the Africa CDC, so that you have more control, of course, and more accountability. So that is the significance of that. And as you recall, it is now an autonomous health agency, which means that it covers a broader set of issues, and not just responding to disease outbreaks. And then the position of the director is elevated to the level of director general, which is the equivalent, will be the equivalent of commissioners or the heads of other organs within the African Union family. So that is the excitement. But the most important is the ability to move quickly. It makes it an agile organization that can move rather quickly.
Judith has come back with another question, and in cases in Kenya, and have been below 5% positivity for nearly 2 weeks. Can we say that we are through with the fifth wave in Kenya? And what is your advice to Kenyans if indeed this is the end of the fifth wave?
But I mean, the end of the wave, first of all, let me just step back and see what I've said before. These waves will continue to come and go. We've seen that how Kenya has managed the first, second, third, and fourth wave, and now fifth wave. So they will come and go. It's rather that it's a normal pattern for this for a pandemic. So we have to continue to practice those safe measures. But I've said before, and I'll just repeat that the time has. This is not a moment to implement massive lockdowns as we did early on. When you implement massive lockdown, as we did early in the pandemic, it was very appropriate to allow us time to gather our own tools to defend against ourselves. It's not a measure that you apply consistently or to the pandemic. We now have seen how Kenya can manage the virus each wave. When it goes up to the peak, Kenya has managed to kind of bring it down, and then the virus escape goes up back. And so Kenya has that experience of managing the waves now. Now, what Kenya must do quickly is, and the population, is an appeal to the population in Kenya, is to cooperate with the government and get vaccinated so that the waves, we diminish the waves. And we know that at some point, a combination of those who have been vaccinated fully and those who have been infected by the virus will lead to some population level of immunity that will continue to play in our advantage and will lead to slowly towards a situation where the pandemic will be more or less controlled. So I think Kenya has the experience in managing these waves. Kenya has the vaccines. The issue now is the vaccination. How do we all work together collaboratively to get the vaccines into the arms and take advantage of the fact that Kenya is down the peak to increase vaccination so that when the next time the virus is increasing, is meeting a population that has a lot of antibodies in the community.
All right, thank you. I can see that Paul Adepoju has his hand up, but Paul, just allow me to give a second question that is related to that, the one that came from Judith, and this one is from Alex Winning from Reuters. Or will we reach an endemic situation in 2022 where the virus is constantly circulating but at lower levels?
A condition for that is ability to vaccinate quickly. And that way, a larger number of population is vaccinated and then also coupled with the existing level of immunity that has been acquired through natural infections. At that point, you can expect that there will be an equilibrium reached where you can expect that the virus will be maintained at a certain threshold. And that is that low threshold of existence, of circulation of virus that we are referring to as endemic situation. So endemicity, as Paul, is not like living with the virus at a high level of positivity. It's rather bringing it down to a certain level, establish an equilibrium where you can either have hotspots or a sporadic occurrence of the virus in the community.
All right, thank you. Now let's say hello to Paul Adepoju. Paul, you've had your hand up for a while. Please go ahead with the question.
Thank you very much, and good morning to Dr. John. Yes.
Hello, Paul.
Hello. Can Dr. John hear me?
Yes,
we can hear you very well, Paul. Go ahead.
Thank you very much. So yesterday, we had a new report by Affinity that 65% of donated vaccines have been used, which means 35% of donated vaccines are yet to be used. I'd like to know, late last year, you mentioned some initiatives that the Africa CDC is undertaking to help several African countries to quickly use up their vaccines. So my question is, between January and now, what has been the difference in vaccine uptake in Africa? What is the trend in terms of reducing wastage? And do you think these policies have been really, really effective? Then it also connects to the second question which I have, which is the long-term endemicity plan for Africa. We heard that the Moderna vaccine that was developed in South Africa may not be ready to make any much difference this year. So I'd like to know the broader plan to ensure that with the virus expected to still be with us for a long period of time, Africa is able to meet is long-term testing, vaccine, and treatment needs. So what is being put in place to ensure that this approach, this interest by African countries goes beyond what we see in 2022 to even several years beyond this? Thank you.
Thank you, Paul. I think let me start with the Saving Lives, Saving Livelihood Initiative, which is a partnership with the MasterCard Foundation. That partnership is going on extremely well. While waiting for many more countries to join, as I explained earlier, if you were on the call, I explained that a set of countries, about 16 of them, have actually been to Morocco to see their experience. And another set was in Rwanda. And as we speak, micro-planning is going on now for about 40 countries in Africa as part of that initiative. I mean, nothing is fast. And you know, we have to go through procurement processes, engagement with the countries, country plans, micro-planning before you get started. At the same time, Paul, and this is very important, there are about 6 countries that each time, or any country that says they are ready to work with us to clear any lot of vaccines that have a risk of expiring. We jump in there. We send teams to support that as part of that initiative. We have data that we can show you from Sierra Leone, South Sudan, Cameroon, Tanzania, where uptake of the vaccination really increased significantly once we send in teams as part of the Saving Livelihood Initiative. So again, while waiting for the long-term planning and everything else that goes through such a massive project, including legal documents that are signed, we have rapid intervention teams. Our team, a set of team just came back from Cameroon this week after the African Nation Cup. We had a team there. If you watch the African Nation Cup, you would have seen that during the adverts, it was Africa CDC and African Union was there because we had a team there for 1 month, helping with the Cameroon and CAF, the Confederation for African Football, to actually help with vaccination because it was a requirement. So that initiative is going on very well, and you see a rapid increase in the number of countries joining that initiative in the coming days. It is a $1.5 billion partnership with the MasterCard Foundation. With respect to the Moderna manufacturing, I will use that to address all other manufacturing. The efforts that are going on the continent now, as part of the African Partnership for African Vaccine Manufacturing, called PAVIM, is going on very well. There are about 10 countries that are engaged now in the process of vaccine manufacturing or planning to do so. Leading countries include South Africa, Senegal, Rwanda, Algeria, and Morocco. You heard that Morocco, the King, have launched the largest vaccine manufacturing site. However, that is not designed to meet the needs for this year, for sure. It's designed with the understanding that we have to find a long-term solution for a vaccine and vaccination in Africa. It's also designed with the understanding that we may be immunizing ourselves almost every 6 months on the continent with this virus. So I think we should be looking at the short-term needs and the long-term needs. The short-term needs, I can argue that within the next coming months, Africa will have enough vaccines. There is a combination of vaccines coming from the AVAT, the African Vaccine Acquisition Task Team, the bilateral donations from the United States and others in France, and those from the COVAX will add up to the vaccines that we need or are required on the continent. The problem now is the vaccination. How do we move those vaccines from airport to arms? I think that is what we bet. The efforts that we are pushing as a continent, as part of the PAVM, the Partnership for African Vaccine Manufacturing, is designed to hopefully address the short-term needs, but more so towards the long-term needs for the vaccine security for the continent.
Thank you very much, John. I think we have another question that has come through from Sarah Jerving with Devex, and it's a follow-up to her last question on the Africa CDC. So she says, what then happens after June? And are the changes effective immediately in terms of the status of the institution? And then finally, she says, do we now refer to you as Director General?
Not yet, but wait. Let the new director who comes in after me be referred to as Director General. I think I'm very pleased with my title now as a director. And but I think to get back to your question, our hope is that in June, the gavel will be hit and Africa CDC will enjoy its new status, because it would have gone through a properly vetted process, which was requested by the head of state. Again, the June deadline is a formality to formalize the operationalization. It is the orders have been given, or the decision has been taken by the head of state, period. So it's a question of making sure that you go through a due process to formalize that. But hopefully in June, if I'm still here, my title with Director General, will be more than happy to celebrate that. But if I'm not here, the new person will enjoy the title of Director General with a much higher rank. But very importantly, with the ability to report directly to the head of state, as well as to the chairperson, Musa Faki Mohammed, more directly.
All right, thank you. I don't see any more questions coming through. So perhaps it is time for you to give us your summary of your main points before we conclude.
Just one message, really, that we will be calling on you all, as always, as we've done in the last 2 years, to join us in launching the campaign for the youths in the coming week. We really hope that in the next weeks, about the next 2 to 3 weeks, when everybody has been engaged and the political leadership and the youth movement engaged, that we can join it collectively. Because we believe strongly that if we do not engage the youths and they take ownership and leadership of this, then we'll continue to struggle to get to the 70%. And I can assume that people who are in our age bracket or even slightly younger have been vaccinated. But the bulk of what we see as hesitancy to vaccines are probably the young people. But if they step in and show ownership and leadership, and recognizing that this is a generational crisis, that if we do not get them involved and solve it, we'll continue to live with a virus that is as disruptive and dangerous as the COVID-19.
Okay, thank you very, very much. Colleagues, that was Dr. John Nkenga Song of the Africa CDC, giving us a rundown of the COVID-19 situation on the continent, and then taking your questions on a number of issues. We will be back with you next Thursday at the same time. Let me just apologize again for the late start. It was really unavoidable, but thank you for your patience and having stayed with us. So let us meet on Thursday at the same time next week. Bye-bye.
Thank you. Bye-bye.